and welcome to Conversations and Connections. This is the official podcast of the Family Crisis Center of East Texas. And again, I'm Stuart Burson, the prevention coordinator for the agency. I'm glad you could join us today. Probably going to be talking about some a heavy topic today. I have with me Kim Riddle, who is our SANE nurse examiner. Did I get that right, Kim?
Yes.
Okay. Now, Kim has the big responsibility of performing exams on survivors of sexual assault. And so we're going to kind of talk about that a little today. So I may want to preface this by saying that we may be talking about some stuff that's really heavy and of maybe possibly mature content. So just kind of keep that in mind as we go about the show today. Well, Kim, first of all, I appreciate you doing this for me. Thank you so much.
Well, thank you, Stuart, for having me.
So your title is SANE Nurse Examiner. Tell us first, I guess, what does SANE stand for? Obviously, that's an acronym. What does that mean?
SANE stands for Sexual Assault Nurse Examiner. And so, yes, that is one of the roles that I have for the Family Crisis Center. Okay. So I guess we'll just kind of start very broad and kind of narrow things down a little bit. So first, just kind of tell me a little bit about your job and exactly what is it that you do, and we'll go from there. Okay, well, that is a big question. So,
you took a big deep breath. Yeah. So,
Okay, so I am the SANE coordinator, which is the director of the Sexual Assault Nurse Examiner program for Family Crisis Center and Harold's House. The two agencies are separate but work together to bring this program to our area. And that role includes many administrative duties, including scheduling, ordering supplies, billing, all the not fun stuff, and also peer reviews and staff trainings, and staying up with any changes to the laws that pertain to the patients that we see. And also, as Stuart mentioned, I am a SANE nurse. I am certified through the state and also internationally for pediatrics and adults. And as a SANE nurse, I am the only one during the day from 6 a to 6 p, Monday through Friday, for 3 counties, Angelina, Nacogdoches, and Sabine.
So wherever something may happen, you have to, do they come here, or do you go to wherever they may be? Then?
We have 2 locations. So we have a SANE suite in Harold's House in Lufkin, and we also have a SANE suite at the Harold's House in Nacogdoches.
And for someone who just may not know, what is Harold's House?
Harold's House is our local child advocacy center, and they provide services to children who are victims of sexual assault, physical abuse, and maybe witnesses to a crime. So
you do the same thing for Harold's House as you would for us. Then.
Absolutely.
You do the exams. Okay, I didn't mean to interrupt you, but I just want to make sure everybody knew what Harold's House was. So
yes,
continue.
And also for the SANE nurse duties, if we have a victim of child abuse or domestic violence with strangulation and they need assessment or documentation of those injuries, I will see them as well. I do serve also as an expert with Texas A&M University in Bryan, Texas, where we train new SANEs to help us throughout the state of Texas. We do have 3 other nurses who work with me. They help to cover night call and weekends, and that is Norma, Veronica, Jackie, and we also have Kim that's in training. And another area of my job includes medical advocacy, and this is strictly for Family Crisis Center. This is where I work with victims of sexual assault and domestic violence who may be displaced and need some assistance with their health care needs. I do work with area agencies such as the Angelina County and City's Health District to provide those healthcare needs and to help the patient navigate the system. Many times they will come and they maybe had to leave quickly.
Okay. Sure.
And they are missing medications or medical equipment that they need in order to be healthy. And so I will help them find ways to get those resources.
Okay. Okay. So the SANE exams, do they take place? I know you said at Harold's house there's a suite there, I guess, where you can do the exam. If it's an adult survivor, do you do your exam? Is it at the hospital, or is there some place within the agency that they go? Where does the exam take place?
That's a good question. Every area kind of has their own system set up. Many are within the hospital systems, and ours used to be. But in 2012, the hospitals were unable to maintain their SANE program and had elected to kind of let that go. And Harold's House and Family Crisis Center stepped in and are working together to make sure that we're able to still offer those services to survivors. And so even if we have a victim who presents to the emergency room, they will contact law enforcement or contact the agency, the hotline, and we will actually perform those exams at one of the two Harold's House locations.
So when you get the call to do an exam, is it law enforcement that calls you? Is it medical staff that call you? How do you get word that there's an exam that needs to happen?
Well, we kind of get those in different ways.
Okay.
We hope that everyone
Sure.
calls the hotline that is maintained here at Family Crisis Center. And after hours, typically that is how we get word. Sometimes they do call us directly at Harold's house, even if it is for an adult survivor. So it may be the medical staff in the emergency room who calls us.
Okay.
It may be law enforcement who calls us.
So it could be
anybody,
really
anybody.
like that.
Typically, we do not have the victim contact us themselves.
Sure.
Typically. But
Right.
we can do we do a reporting sexual assault exam, and that is where the victim is wanting to move through the judicial system. They are wanting to file charges. But we can also do a non-reporting sexual assault exam, and that is where the victim, they want that evidence collected, but they are not ready to file a complaint with law enforcement. And so we go through the same process, and then that evidence is shipped to a different lab where it is stored for 5 years to give that victim time to decide
Okay.
if they want to move forward or not.
Okay. Okay. So it's also kind of important to point out that when you go do an exam, there's also a possibility that a sexual assault advocate may be there as well. I know we have advocate training here at the agency, and we have advocates on staff, and advocates can also be volunteers. So there may be someone else with you just to, you do the exam, but the advocate's role, I guess, is just to be more of a supportive role, I guess, for the survivor.
Advocates are just wonderful, and they help the victim tremendously. And so what happens usually with the process is when that call comes in, we set up for the entire team to come out. So we will have the victim, we'll have law enforcement, hopefully. We will have the SANE nurse who is on call, and also the advocate who is on call. So not only is that advocate there to provide that support, but they're also there to give information about the Family Crisis Center and all of the services that we can offer this victim to help them heal from the trauma.
Okay. Okay, so I'm going to address the elephant in the room here, I guess. What takes place when you do a SANE exam? What do you do? I mean, what is a SANE exam?
Okay. It is a medical forensic exam performed by a SANE nurse. And our nurses are all specifically trained to care for the victim of sexual assault. So we are trauma informed. We know, how to speak to this client and, how to help them through this process. So the parts of a sexual assault exam, number one would be that history. And the history is for the purpose of the diagnosis and treatment. You also have a head-to-toe assessment for trauma. You will have an anogenital exam assessment for trauma. We will collect evidence as indicated by the history, and we are also trained to present that evidence in court. So basically, they're coming in, we're going to see what has happened. We are using that information to guide the exam, to tell us what evidence may need to be collected. And at the end of it all, we sign it over to law enforcement, and it's sent to a lab. And if it's a non-reporting, then we send that to a different lab.
Okay. So, in the movies and on TV, you always hear, and I don't know, I always hate to say it like this, but I guess it's your job to administer, is it a rape kit? I don't know why I hate that word. It just sounds so crass for some reason, and it may not be, but is that basically what it is?
Well, we do call it an evidence collection kit because when you think of rape, you're only thinking of one thing, and sexual assault actually involves many other acts upon a victim.
Right.
And but yes, I guess some people might refer to it as a rape kit, but we do call that the sexual assault kit or evidence collection kit. And basically, that's what we're doing. We're looking for any type of injury, any type of DNA that we might find.
Sure. I think I may have mentioned this to you. It was a couple of years ago, 2 or 3 years ago. I guess a couple of years ago, it was that time when I had to actually go in person to DPS to renew my driver's license. And when I was filling out the form, they have you list all these possible things that you can allocate money towards. I guess part of the fees, of whatever that you paid to get your driver's license. And one of them was, they specifically mentioned the evidence kits. So if people, keep that in mind, I guess, that your money can go towards something like that when you go to renew your driver's license. I just thought that was really interesting. I didn't know that.
Well, let me explain that. So,
okay.
Across our country, we have had a huge backlog of evidence collection kits that were not being processed. And so what happens is that DNA is not entered into any type of database to where we can look to even see if we have maybe a serial rapist, or also to help with the DNA that might be needed for evidence whenever you're moving through the court system. And so not just here in Texas, but across the nation. Excuse me.
Sure.
But Texas is or has been a leader in trying to work through the backlog of kits and to get them all tested. And I have spoken with law enforcement recently, and the process that was put into action last September is definitely making a difference. Our sexual assault kits now, excuse me, the sexual assault kits are put into the kit tracking system. So every time we have a case, I will enter that specific number into the database with the state. And that keeps everyone accountable. So we have a week to get it to law enforcement, or they have a week to get it from us. And they have like 30 days to get it to the lab. And the lab has 90 days to get it back to them. And so law enforcement has told me that they are excited about that. It used to take 3 years or more to even get, if ever, that DNA evidence back. And now they are receiving it within that time frame. And so this is helping these cases to be able to move forward.
Okay. Mm-hmm. All right. You see, I'm sure all different kinds of people when you do the exam. I'm sure there's some people who are very willing to undergo the exam, and I would guess there's probably some folks that are very reluctant to, they've already been through an assault, and to have somebody do a physical exam must be so stressful and so hard on someone.
I love that you're bringing this up because I actually get this question a lot. And the reality is the SANE exam is not traumatic. We work very hard to make sure that the process goes very smoothly. We are there to support the victim.
Uh-huh.
It can actually be a healing process for them,
Okay.
to where they know that someone has checked them over. They know that their body is going to be okay, and that's like the first step in recovery
Okay.
over the event that has happened. So I wouldn't say that it traumatizes them at all. I would say that it is really and truly the opposite. And no one is ever forced to go through that process. They have the option at any time to say, no, I don't want to do
Right.
that, or I'm ready to stop. I don't want to move forward. So they have that right, and they have that control over what is happening to them.
Okay. How? Well, I guess I was thinking of something else, but we may go back to that in a little bit later. Can you tell me? Is there a rough estimate that you can tell me about how many exams do you do in a week? I mean, I don't know if that's a legitimate time frame. A week or a month might be better. I don't know, but how often do you have to do this exam?
There is no way to predict how the day or the week is going to go. There are days when I do multiple exams in a day. There are days when I don't do any exams. And so it varies. It varies greatly.
Yeah.
It's just, sometimes it's just crazy and you can't catch up. And then sometimes we don't really have anything coming in. So,
and when I do my prevention work, I always stress to everyone that they know that men can be victims of sexual assault as well as women.
absolutely.
And how often do you see men, or is the procedure pretty similar? And how does a man react to the trauma of the assault? I'm sure, I don't know if it's any different than a woman, but do you see very many men and have to do this for men?
We do see men, definitely fewer men than women.
Sure.
I would say that the process is still going to be the same. We're still going to go through the history and the assessments and collect that evidence. I do think sometimes maybe it is harder for men to come forward just because, I don't know, I think they may feel like they should have been able to stop the assault. And sometimes women feel like they should have been able to stop the assault, and that can lead to feelings of guilt, and we don't want that.
Right.
So absolutely all the same services are available. They are not based off gender. So we are there for them.
Okay. And something else that you do, we've been talking about the SANE exams, but I've been to, and I still want to one day, I want to go through one of your trainings that you do for law enforcement just to see what that's about. I think that may help me do what I do as far as, in my prevention work. But you also talk to schools about STDs as well, and you have these fun little props that you use.
Yes.
And how is that? Tell us, if you don't mind. Let's just briefly just kind of touch on that. What do you do when you talk to students or to the public about STDs?
I would say that the presentations and the trainings that I do out in the community are probably one of my favorite things that I get to do. When I first started here, I remember telling Glenna that I do not want to speak in public. Like, do not sign me up. And that did not last very long. And in reality, I do presentations pretty frequently, and I love them. I usually bring a team of other people with me because we all have our specialties, and we'll go over things like child abuse, sexual assault, domestic violence, human trafficking, strangulation, and sexually transmitted infections. We do go to schools. We go to civic organizations. We do this with the cadets at Angelina College, and we also with different law enforcement agencies within our area. Yes, and I do have those toys. Stuart, thank you for bringing that up. But one of the girls from Harold's House went to Austin for a training, and she saw these stuffed animals that are made up of, like, I have gonorrhea, chlamydia, herpes, HIV, all these different things. And they're kind of a blowed up version of what you would see under the microscope in a stuffed toy. And so, yes, we do take those, and it is a lot of fun to throw it out into the crowd,
Right.
And have them stand up and say, oh, yes, I've caught chlamydia or I've caught gonorrhea.
And it's a little stuffed little animal or whatever that represents that
does.
disease. Right?
And it helps us to open up those conversations because people do not want to talk about infections that are within the anogenital area.
Well, and that's one thing. And I was wanting to ask you, whenever you address, let's say, like the cadets at the police academy, do you find that a lot of them don't want to look you in the eye when you start talking about things like this? Is there a level of embarrassment that goes around the room?
There is, I will say, and even at schools, we went around to all the area school administration in Angelina County not very long ago, and people are embarrassed to stand up and say, "Oh yeah, I caught herpes or I caught gonorrhea," but it opens up the conversation. What if you were a victim of sexual assault and you got one of these infections, and this was not your choice, and you don't come forward and you don't tell anybody that you're struggling with maybe symptoms, or you're not tested because you don't realize you should be tested. And so you don't want to say anything because you're embarrassed to talk about it. And that can be very limiting towards treatment. So I love having these conversations. We need to talk about it. If you're going to go to Walmart and nobody wears a mask, are you at risk for COVID? Yes. So if you are sexually assaulted or you are having unprotected sex, are you at risk for catching a sexually transmitted infection? Yes, absolutely. So it just helps to open up that conversation. And we all laugh and we have a good time with it, but it's really about education.
Teens and young adults today, as tech savvy as a lot of them are, and I don't know if this is even related or not, are STDs still as big of a problem as they were, let's say, when we were in school, or kids?
Are you trying to say our age there, Stuart?
I'm trying to very daintily step around it.
I don't know.
Are they? I guess, are they as knowledgeable today? And is it still as big of a problem as it was, say, 20, 30 years ago?
Well, first of all, we do call them sexually transmitted infections because many of those we can cure with an antibiotic. Okay. So the term STD we don't use as much anymore, but many people that it's still the term that they are going to use. And they are a huge problem for our young people. So 1 in 4 young people will have an STI by the time that they're 25. We also know that HIV is making a rise in our young people ages 15 to 24. And the reason is that young people, they are having unprotected sex. We are not talking to them about prevention. Okay. And they're not being tested. And so they're spreading these things. And, we definitely let them know that the only 100% way is going to be abstinence, right? But that if you do decide that is something that you want to do, you want to use protection. And then when we look at the sexual assault side, you don't really get a choice. You've been exposed to things, right. Against your will. and they need assistance in how to get tested and how to be safe.
And I'm sure that's a concern for someone who's been assaulted is, it's traumatic enough being assaulted, but then on top of that thinking, well, do I have a disease or an infection?
Absolutely. It is a huge concern. And sometimes that may be what brings someone to go ahead and come in and talk to us. We work closely with the Angelina County and City's Health District. They do help us with the testing for the ones who have been sexually assaulted. So we make those referrals to them. They are able to test and treat for a very minimal fee because of their grant funding, but they are a huge resource in our area.
Okay. I've asked this question to a lot of people who do direct care services with the agency. And I always kind of joke a little bit with Kim. Anytime you see her and she comes into this office, she is smiling and she is laughing, and you always have such a good attitude, and you're just so bubbly, and I'm thinking, this lady deals with some heavy stuff. What do you do at the end of the day to, I guess, separate yourself from the traumatic things that you may have encountered during that day? Or how do you practice self-care? Like, what do you do to keep that from just building up and affecting your mental health?
Well, I have multiple things. Number one, I will say that I have a strong faith in God, and I really just let all of that go and give that to Him. I also have a wonderful husband who is extremely supportive, and he's wonderful. And I enjoy being outside. I like to go home sometimes after a bad day, and I may go walk my dog or, mess with my horses. And those kind of things are very therapeutic to me, just being out in nature. And sometimes that's when I'm having my conversations with God. And it's not that these things don't affect me. I mean, sometimes I cry and sometimes I'm angry, and then I have to let that go. People ask me, how do you do your job? And, that I don't think I could do that or whatever. But, really, I love my job. I feel like I am exactly where I'm supposed to be. I am on the healing side of the trauma, right? The trauma's already happened, and I'm there to kind of help that victim, move forward and on the caring side. So I love that. I love what I do. I work with amazing, caring, supportive people at Family Crisis Center and at Harold's House. And so my work team is huge to me and very supportive. And so I guess that's it. That's
okay.
that's a lot.
No, that's great. So when little Kim was trying to figure out what she wanted to do when she grew up, and you decided you wanted to be a nurse, did you ever think, what got you interested into this part of nursing? Because nursing is there's such a huge gamut that that you can that you can do in the nursing field. What made you decide to do what you do?
Well, that's a good question. I have tried many areas of nursing, and I think that's what's so wonderful about nursing is there are so many areas of practice that are available to you. But I don't know. I really just feel like when the timing was right, I was ready for a change, and really I just kind of opened it up to God and said, "Okay, I'm ready. Now what are we going to do next?" And it's always been a field that I was just kind of interested in. And he just opened all the doors, and really, that's how I'm here today.
And how long have you been doing this for the Family Crisis Center?
5 years.
Oh, okay. So not
Yeah.
really in the grand scheme of things, not very long.
Yeah.
I guess. Okay.
I've been a nurse since 1993, so for 27 years. So I've definitely been in all kinds of areas, but But yeah, it feels like I've been here 100 years, but really it's only 5 years. So
All right.
It's been a ride for sure.
All right. Well, Kim, thanks. I appreciate this time. And I may have you back in the future if we decide to dig deeper in a specific area. I'd love to have you back to talk more, but thanks a lot.
Okay. Well, thank you for having me. I did enjoy being here today.
Well, and if you have any questions or comments about this episode, we do have an email address. Of course, that is conversationsandconnections@fccet.com. And if you feel like you need our services for any particular reason, we do have a toll-free hotline that is answered 24 hours a day, 7 days a week. That number is 1-800-828-7233. That's 1-800-828-7233. And as always, remember, be the voice. And if not for you, for someone else.